And I'm recording. Good evening. My name is Christian Harriet, Mid-Atlantic Regional Professional Relations Lead, and I'd like to welcome you to today's virtual discussion, Bringing the Fight to Lupus Nephritis, sponsored by Aurinia. I'm now very happy to introduce our physician speaker. I'd like to introduce you to Dr. Elizabeth Clayton, rheumatologist from the Rheumatology Associates of Delmarva. She is a graduate of the University of Maryland Medicine School System, and her residency and fellowship were completed at University of Maryland. She is also a fellow of the American College of Rheumatology and an active member of the Association of Women in Rheumatology. And with that, Dr. Clayton, you may begin.
Thank you so much, Christian. So before I start, I just want to say thank you for your time today. It's an honor for me to speak to you all as advocates and patients and ambassadors. You guys are the reason that we do what we do, and it's so great to engage with everybody. Today we're going to talk about the first and only FDA-approved oral treatment for lupus nephritis, that's Lupinus. So this is a prescription medication that's used in conjunction with other medicines to treat active lupus nephritis. So a couple warnings: Lupinus should not be taken with a medication called cyclophosphamide. So if you're on that, you should certainly talk to your doctor about it. And with any talk like this, we're going to talk about safety information throughout the discussion. We'll start with the big warnings for the class of medications here. And then at the end, I'll kind of bring it home with the more exhaustive list of things. So Lupinus is considered an immunosuppressant, and with that comes warnings for increased risk of cancer and infection. So people taking Lupinus can be at increased risk for certain kinds of cancers, including skin cancers and lymphoma, which is lymph node cancer. We always warn patients to limit and avoid exposure to sunlight and UV light, such as tanning beds or excessive outdoor sunlight. We advise always to wear protective clothing and use sunscreen. And while this is important for the medication as far as the risk for cancer goes, this is also a general guideline that a lot of you guys are probably very familiar with living with lupus, because we worry about skin disease in lupus. There's also an increased risk of infection. So Lupinus is a medication that can lower your immune system's ability to fight off certain kinds of infections. And so if you're on medication and you have certain symptoms like fever, sweats, chills, flu-like symptoms, you should certainly let your doctor know these things. There's certain medication classes that you can't take while you're on Lupinus. So strong CYP3A4 inhibitors like ketoconazole, itraconazole, and clarithromycin are contraindicated, meaning you should not be on them together with Lupinus. Similarly, we advise not to eat grapefruit or drink grapefruit juice, because this too is considered a strong CYP3A4 inhibitor. So before using Lupinus, always give full disclosure to your doctor. I mean, we ask this anyway, but a lot of this stuff is just making sure you have bullet points to discuss. So make sure we are aware if you're going to be receiving any vaccines in the future. Live vaccines are contraindicated, but killed vaccines are likely safe, but we just don't know if you're going to actually mount an appropriate response and how beneficial they're going to be. Let your doctor know if you have or had liver, kidney, or heart problems, or if you have high blood pressure. And then in all lupus patients who are of childbearing age, pregnancy and breastfeeding plans are very important. There are a lot of medications that we could potentially use that need to be avoided in pregnancy and breastfeeding. So pregnancy planning and family planning, your rheumatologist should always be part of that. Always tell your healthcare provider about everything you're taking. This doesn't just mean prescription drugs or over-the-counter medications. A lot of people forget about herbal supplements, dietary change supplements, vitamins, etc. We want to know all of that because there are certain interactions that we should need to be aware of. So tonight's talk is going to be divided into 3 parts. So you're going to have information in this first section about lupus nephritis, in the second section about the drug and the trials that have been done on it, and in the third section on how to take the medication. So what is nephritis to start out with? So as a term, nephron is the active filtering unit of the kidney. Itis always means inflammation when it's added onto a word. So lupus nephritis is kidney inflammation caused by lupus. So this is a common and serious complication of lupus, and it happens when the immune system attacks the kidneys. That causes a very robust inflammatory reaction that can cause permanent and irreversible kidney damage. If this goes untreated, it can lead to kidney failure, which is cause for dialysis or transplant. So who are our at-risk population? So on average, about 1 in 2 people with lupus may go on to develop lupus nephritis. That will vary depending on which group of patients you're looking at. Lupus nephritis is 4 times more common in patients of African and Asian descent compared to their white counterparts. It's also 2 times more common in Hispanic and Native American populations compared to white counterparts. So these are our more at-risk populations. So what are common signs and symptoms? So signs are things that we see on a physical exam, and symptoms are things that you would report to us. So while we'll talk about these 4 symptoms and signs, it's important to note that this is not an exhaustive list and that you don't have to have dramatic presentations of this or even consistent symptoms. Sometimes disease is insidious and very subtle in how it comes on, and people can have stuttering, inconsistent type symptoms. So swelling is something that's commonly reported, typically in very gravity dependent areas like the ankles and feet. If this is dramatic, it can involve the calves, around the eyes, the face, the hands. Also changes in urine. So when you start to see foamy or frothy type urine, and it hasn't been like that previously, that can be a sign that there's protein in the urine. Increases in blood pressure are also important. Your kidneys are kind of the gatekeeper for your blood pressure. So imagine that they're not filtering properly and they're not getting rid of everything they should be because of the inflammation. You can see an increase in blood pressure from that. And then frequent urination, especially at night. Again, to stress, the symptoms can be subtle and can be fairly inconsistent. So keeping a symptom journal is important a lot of times. So what are the clinical signs that we want to look at? So urine testing is the biggest thing that we want to see. And that will show blood in the urine or protein in the urine if there is nephritis. So testing for nephritis depends on whether you have active lupus nephritis or whether you're a lupus patient who's considered high risk. Patients with active lupus nephritis need to be tested every 1 to 3 months. And that will depend on what medications you're on in the background and kind of where you are in that treatment. Patients who are higher risk for nephritis but don't yet have that typically are monitored every 3 to 6 months, depending on your disease characteristics, and your doctor will determine what's appropriate for you. The point of protein testing in the urine is to see if the urine protein levels are above or below 0.5 grams. When we start to see urine protein levels go above 0.5, that's when we start to worry as far as protein getting out of the bloodstream and into the urine, giving us an idea that maybe there's something wrong with that kidney. Catching nephritis early is vital because that will help to treat earlier and then prevent long-term irreversible damage that could lead to end-stage kidney disease. So how do we formally diagnose lupus nephritis? So I talked about the urine tests. We also do blood work as a workup to see what's going on. That's going to look at certain indices. So measuring creatinine, which is a product in your blood that's typically filtered out by the kidneys. But imagine that a kidney is not able to filter properly because of inflammation, and that creatinine level in the blood will rise because it's not being excreted properly. That can be a sign as well. The ultimate way, if you're doing these urine tests and the blood work and the signs are pointing towards there being a possible nephritis, the ultimate way to make that diagnosis is on a kidney biopsy. And that's done usually under ultrasound guidance through the back. And that's because your kidneys sit in the rear part of your abdominal cavity. That will help us get a sample of tissue to look at under the microscope to see actually what's going on. Is there inflammation? Is the kidney damaged? Is there scarring already? It gives you an idea of how much active disease is there, but also how much chronicity and how much damage is there. So obviously, lupus nephritis can have very serious long-term side effects, right? You can have permanent kidney damage, which can lead to a whole bunch of downstream effects, including increases in blood pressure or progression to chronic kidney disease, which can lead to end-stage disease requiring transplant or dialysis. You can have permanent damage to the kidneys in the sense of you're going to need to start changing medications you're on or avoiding certain medications. And then cardiovascular complications like heart attacks and strokes. I think the important take-home point here is that identifying patients early, treating early is going to give you the better long-term outcomes as far as not allowing people to progress and not seeing that end-stage disease years down the road. So the first line agent for treatment is always going to be steroids. And that's because steroids come in and clean everything up, right? They are kind of like the vacuum cleaner to get rid of inflammation, if you will. But we can't rely on them at high doses for long periods because of side effect profile, which a lot of you, I'm sure, as lupus patients are very familiar with. We worry about long-term irreversible damage to other organs from steroids. That's also a significant cause of complications in lupus patients. So we consider higher dose steroids to be doses greater than or equal to 7.5 milligrams per day. Those doses and above, or that dose and above, is going to be what can predispose to that irreversible damage. A helpful number I keep in mind and a calculation I keep in mind when I'm prescribing higher dose steroids to a patient is that every 1 milligram increase in average daily steroid dose can increase the risk for new organ damage by 3%. So frame that in the setting of someone being on 20, 25, 30 of prednisone for a long period. You can see how that risk really starts to accumulate over time. So what can actual lupus nephritis treatment do? So while steroids come in and clean up that mess, they don't actually stop the process that's causing this, and they don't ensure a good long-term outcome. We use medications in the background to help eliminate steroids and to help give the best long-term outcomes. We want those treatments to reduce inflammation and stop that aggressive attack on the kidney to get the disease under control. The goal is also to help prevent that further damage from accruing. So until recently, there were no FDA-approved treatments for lupus nephritis. Now, we had what we consider a standard of care, where we have a medication regimen that we typically use, which is mycophenolate and steroids together. But Lupinus is the first FDA-approved oral treatment that's specific for lupus nephritis. So Lupinus, or voclosporin, which is the generic for this, is the first FDA-approved oral medication for those living with active lupus nephritis. Again, to reiterate these points, you'll hear me say multiple things again and again throughout the talk. You cannot take Lupinus if you're taking cyclophosphamide. So make sure you're talking to your healthcare provider about your medication list and what the possibilities are for you. Lupinus acts in multiple ways to help stop that attack on the kidneys, and we'll get into some of the details of that as well. It will help to get lupus nephritis under control. It's given in the setting of standard of care, so it's given with mycophenolate and steroids together. And it's shown to work without using high-dose steroids for long periods. I think that's a very important take-home point here, which makes this medication different than its predecessors. It will also reduce the protein in the urine faster than mycophenolate and steroids alone. So lupus nephritis is a common and serious complication of lupus. Patients with lupus, meaning systemic disease, who don't have nephritis yet, should be tested for nephritis every 3 months. Depending on your specific case, what your antibody status is, how long you've had disease, that can be changed either to a shorter interval or longer, and your rheumatologist can determine that. Those with active nephritis should have their urine and blood tested as often as monthly. Sometimes it's actually in shorter intervals than that, and sometimes it's a little longer, depending on what medications you're on and how long you've been on them. So Lupinus is specifically approved to treat lupus nephritis and has been proven to help control the underlying disease process, which is important for that long-term outcome we want. You can ask your doctor about Lupinus and also about your specific needs for screening. There are excellent patient resources on lupkinus.com. There's a doctor discussion guide. There's some discussion prompts on there if you want to bring this up to your doctor. So getting into the second part of our talk, we'll talk about Lupinus as far as the clinical trials go and what we saw outcome-wise. So again, simple reiterated points here. First, FDA-approved oral medication for lupus nephritis that helps to stop the disease process and the damage that can accrue. It is all in the setting of lower dose steroids than we would typically use as part of standard of care. This medication is given in conjunction with that standard of care, which is mycophenolate and the steroid taper. So the very interesting thing about Lupinus is that it has a dual mechanism of action, unlike anything that's come before it for lupus nephritis. So it helps in that immunosuppressant way, where it's going to stop that immune reaction that's going to lead to all of the inflammation. But it also has this interesting second mechanism, which is going to help to stabilize the kidney filtering mechanism, the cells that are helping with that. We call them podocytes. It'll help to stabilize their skeleton so they stop leaking, which is part of this whole disease process. That's why you see the significant reductions in urine protein that we'll talk about, because of this dual mechanism. So Lupinus was studied in over 350 people across different races and ethnicities, representative of our patient population. And clinical trials showed that Lupinus helped to get lupus nephritis under control, which the definition of a complete response is going to be getting that urine protein to less than 0.5 grams per day, all while helping to maintain kidney function. It worked without high-dose steroids, and it reduced proteinuria, or protein in the urine. So patients taking Lupinus had a 3 times greater chance of being in complete remission at 1 year compared to their counterparts in the standard of care group who were just getting mycophenolate and steroids. I think that's pretty astounding when you look at what we've seen as rheumatologists over the years. This is really reassuring as far as the data goes for how high the likelihood is for people to reach complete remission. So it worked in the setting of lower dose steroids, which again, reassuring given the long-term side effect profile of steroids. We also saw reductions in proteinuria. So just to back up a little bit, proteinuria is the single biggest prognostic predictor in lupus nephritis for long-term outcome, meaning those who had a significant reduction early in their treatment course in general had better long-term outcomes. And tracking urine protein is very important in this disease state. So in the clinical trials, Lupinus helped to reduce urine protein almost 2 times faster than mycophenolate and steroids alone. And you can see that graphically represented, right? Half the time it took, essentially. So Lupinus is in your peach colored bar, and mycophenolate and steroids are in your white bar. Remember that too, the Lupinus group, those patients were also on standard of care, right? So they were on mycophenolate and a low-dose steroid regimen. So again, to reiterate, it's important that we see these drops in urine protein because that's giving us an indicator that long-term prognosis is good. So people taking Lupinus saw a 50% reduction of proteinuria after just 1 month. Pretty dramatic compared to what we have previously seen with the standard of care. So what you should know before starting Lupinus, a lot of this I went over in that initial slide, but just to reiterate, can't take with cyclophosphamide. All family planning plans really need to be discussed with your rheumatologist or nephrologist and your OBGYN as part of a group. It's important that we know if you're going to become pregnant, when that is hopefully going to be, and then what your breastfeeding plans are, just because a lot of our medications are going to be contraindicated, including Lupinus, during these times. Don't take with strong CYP3A4 inhibitors, and don't take if you're allergic to voclosporin or any of the ingredients that are in Lupinus. So side effect profile is something we get asked a lot. In the green box on the right, you're going to see the common side effects that were reported in the clinical trials. So diarrhea, headache, cough, urinary tract infection, stomach pain, heartburn, and loss of hair. These are all in lower percentages, but still reported, so you should be aware of these when you're starting the medication. If you're on Lupinus and you develop any of the symptoms or any of the signs on the left, you're going to need to let your doctor know. Some of these we're going to pick up on more so than you. So kidney problems or high levels of potassium, that's probably going to be caught on blood work that's done by us or your nephrologist. If you develop high blood pressure, I try to engage a lot of the patients to be checking this at home. So if you're tracking along and you're noticing that on treatment, your blood pressure is creeping up, we need to know that. If you develop any nervous system issues, so confusion, change in mental status, headaches, numbness, tingling, weakness, etc., those are relevant and we need to know. If you have a known heart issue called QT prolongation, So QT intervals are part of your EKG. And if there is a prolonged interval between that Q and the T on your EKG, you can be predisposed to certain kinds of arrhythmias. And certain medications can prolong that QT interval. Lupinus is one of them, and hydroxychloroquine, which a lot of you are familiar with, is another. So as you start to add multiple drugs to a regimen, if somebody has a known prolonged QT interval, that's important that we're aware of that. Severe low red blood cell count, or we call that anemia, we need to know about that too. Again, we're going to see that on your blood work most likely. This is not an exhaustive list of side effects. You could certainly look this up on lupkinus.com as far as all of the safety information. If you do have side effects, you can contact Aurinia Alliance, or you can also contact the FDA directly. I think your first line is going to be to reach out to your prescribing doctor so that they're aware as well. So Lupinus is really helping to transform how we approach lupus nephritis, not just in the sense of treating patients, but we're hopeful to see long-term outcomes over the coming years with less and less permanent kidney damage in this patient population. The medication will help to stop the attack on the kidneys, but also stabilize those filtering cells in the kidney to help long-term. This is all accomplished in the setting of a lower dose steroid regimen. So you're trying to avoid those long-term steroid side effects. So getting into the details about the medication specifically. So again, kind of a summary slide here. It's taken in conjunction with mycophenolate and steroids to stop that attack on the kidneys. And it can help long-term to avoid kidney failure. So the dosing schedule, it's taken by mouth, not an injection or an infusion. It is a standard dose of 3 capsules taken twice daily. There are alterations to this with regard to patients' kidney function, liver issues, etc. So this might not be your starting dose. Your doctor will determine that. In general, the dosing schedule will stay the same throughout treatment. So always take on an empty stomach. We try to encourage as close to 12 hours apart as we can, but with a minimum of 8 hours between the doses. The very important point here is that if you forget your dose, but you remember within 4 hours, take the dose. But if you're beyond that 4-hour window from when you were due, skip your dose and go to the next dose. We don't want to stack or double up doses because that can increase the risk of side effects. Don't break, crush, chew, dissolve. These are capsules, so leave them intact and swallow them whole. And always take Lupinus as your doctor recommends for you. So your capsules are going to come in a blister pack of sleeves, like you see here on the right. They're going to come boxed up. It's important to leave them in the sleeves until you're ready to take them. That if you start taking them out, putting them in other bottles, leaving them out in the air, that can compromise the quality of the capsule and therefore the medication. So we want to make sure you leave them in the blister pack until you're ready to take them. If you plan to travel, take the blister pack with you. So always take your medications as we prescribe. I think that's a moot point a lot of times. Stay up to date with appointments and lab draws and what your set plan is. If you're unclear about what your plan is as far as where you're supposed to be for doctor's appointments or when you're following up or what labs you need, make sure you're engaging with your doctor about that. Keep a symptom journal. I think this is super important in lupus because like I alluded to in the beginning, a lot of times symptoms are subtle, very slowly developing, and you might not notice something or think something's relevant, but we might think it's very relevant, and vice versa as well. Always engage in making sure you're looking at your own blood work and urine tests. Ask for logins for your medical records system and whatever portal you use for lab work. So looking at your urine tests, watch your urine protein as you're on treatment and hopefully see it go down and your urine blood levels disappear. I think it's very gratifying for patients because we know you guys put a lot of time and effort into staying compliant with your meds and keeping up with doctor's appointments. I think seeing the fruits of all your labors is important. Sometimes us just telling you, oh, your labs look better, I don't think that gives you the credit that you guys deserve. So make sure you're engaged in looking at these things. Monitor your blood work too. You can watch that creatinine level go down. You can also watch a calculation which is called the estimated glomerular filtration rate, or EGFR, which is how well your kidneys are filtering. You can watch that go up with treatment if it started out abnormally. So that's gratifying as well. So there's a great program through Aurinia called Aurinia Alliance. So I'm going to turn this over to Christian to speak to this now.
Thank you very much, Dr. Clayton. And the important thing is to remember that you're never alone. Aurinia Alliance is a program specifically for people living with lupus nephritis and taking Lupinus. It's designed to provide resources for people with this disease and their care partners. The program is staffed by registered nurses who have experience in insurance and funding issues. If you enroll, you'll be connected with a nurse case manager who will be your dedicated contact throughout the treatment journey. Nurse case managers will help you learn more about lupus nephritis, assist you in navigating insurance and funding options for Lupinus, and can help you stay on track with Lupinus treatment. Nurse case managers from Aurinia Alliance do not give medical advice and will direct their patients to the healthcare provided for any disease, treatment, or referral-related questions. Nurse case managers from Aurinia Alliance are available by phone Monday through Friday, 8 a.m. through 8 p.m. Eastern Standard Time. Now, please note that enrolling in Aurinia Alliance opens the door to dedicated support. Your nurse case manager will partner with you or with your healthcare team to help initiate your Lupinus treatment and help you access everything the program has to offer, including educational resources, information about treatment, financial assistance, and working with your specialty pharmacy to fulfill your Lupinus prescription. After you're connected with the nurse case manager, they will be with you every step of the way to help you stay on track with your Lupinus treatment. It's important to connect with your nurse case manager to get started on the next steps. They will contact you through the Lupinus treatment journey, so please add this phone number to your contact list. This is important: 1-833-287-4642. And if someone from that number calls, please do not dismiss it as spam, as that is the number that your nurse case manager will call from to help you complete the enrollment and coordinate with your doctor and insurance to get you the help for your prescription to be filled. Thank you, Dr. Clayton.
Okay, just to kind of bring it home now. So we'll go over the rest of the important safety information. A lot of this we already went over, but just to make sure we summarize everything. So Lupinus can have serious side effects. So there are issues where you can have kidney problems from the medication. These medicines can cause, this class of medicines can cause constriction of blood vessels. So that can sometimes lead to poor flow to the kidneys. That will be caught on blood work, and typically dose adjustments in the medication can improve that. So it's important to stay up on your blood work, make sure you're getting it done and following up with your doctor appropriately. In the same way with the constriction of blood vessels, we can see a raised blood pressure, high blood pressure. We encourage, at least in our practice, for patients to do this at home. And we also obviously do it when you come into the office. Nervous system problems have been reported. They're uncommon, but should be reported to your doctor if you have any of these symptoms, which we've talked about previously. If you've had high levels of potassium in your blood, we're going to need to know that as well. I already went over QT prolongation with you guys, as well as if you've had severe low red blood cell counts or significant anemia. And then important to reiterate, the most common side effects that were reported were diarrhea, headache, cough, urinary tract infection, stomach pain, heartburn, and loss of hair. Visit lupinus.com for the more extensive list, or exhaustive list, I should say. And if you have concerns about side effects, you can reach out to your doctor, Aurinia Alliance, or the FDA at the listed numbers. So I really appreciate your time, and I hope that we can all continue to work together. Again, it's an honor to speak with you guys about Lupinus as well as about lupus nephritis. You are our biggest advocates, so we appreciate that, and we're always here to help.